We've all heard that 120/80 is the perfect blood pressure, but what if this gold standard is actually risky for seniors? For decades, this number was based on research in younger adults. Doctors have pushed hard to get everyone, including seniors, to hit it. But new evidence shows that aggressively lowering blood pressure in older adults can be harmful. Seniors' bodies are different. Sometimes, a slightly higher blood pressure is actually safer, ensuring enough blood reaches the brain and vital organs. The real goal: not just hitting a number but keeping seniors steady, safe, and functional. It's time to look beyond the cuff and see the whole person. Meet Eleanor, 78, active and independent. Her blood pressure was 145/85, higher than the ideal. Her doctor prescribed a strong medication to lower it. Soon, Eleanor's readings dropped to 115/75, but she felt lightheaded, especially when standing up. She brushed it off as aging. One day, she stood up in her garden, got dizzy, and fell, breaking her hip. In the hospital, doctors realized her blood pressure was too low for her body's needs. The medication had caused orthostatic hypotension, a dangerous drop in blood pressure when standing. Eleanor's pursuit of a perfect number led to a devastating fall and loss of independence. Her story isn't rare, it's a warning. Treating numbers, not people, can have serious consequences. For some seniors, a higher blood pressure is what keeps them safe and steady. The lesson: medical care must be individualized, not one size fits all. Numbers are just data points. The person matters most. Eleanor's experience shows the real cost of ignoring this. Treat the person, not just the number. Why isn't lower always better for seniors? It comes down to aging arteries and slower body sensors. Young arteries are flexible, but as we age, they stiffen, raising blood pressure naturally. Forcing blood through stiff arteries often requires higher pressure to keep the brain and organs supplied. Aggressively lowering blood pressure can reduce blood flow, causing dizziness and falls. Baroreceptors, our internal blood pressure sensors, also become less responsive with age. When seniors stand up, their bodies may not react quickly enough, leading to dangerous drops in blood pressure. Medications can worsen this, overwhelming the body's natural safety systems. The result: increased risk of falls and confusion. Major studies have changed how we view blood pressure in seniors. Research shows a J-curve. Both very high and very low blood pressure increase risk of death in older adults. The lowest risk isn't at 120/80, but often in the 140/160 systolic range for those over 80. Aggressive lowering can cause more harm, like fainting and kidney problems, than benefit. The SprintMind study found that while lower blood pressure can reduce some risks, it also increases side effects in seniors. The takeaway: the sweet spot for seniors is usually higher than for younger adults. The goal is to balance long-term health with immediate safety and quality of life. Personalization is key. One number doesn't fit all. So, what should seniors aim for? There's no single answer. For healthy active seniors 65-79, a systolic target below 140 is reasonable. If you feel well at 130, that's fine, but don't push lower if it causes dizziness or fatigue. For those 80 and older, or with multiple health issues, a target below 150 is often best. Sometimes, 140-150 is optimal, especially if it keeps you steady and independent. The focus shifts to preventing falls and maintaining quality of life. Your personal target depends on your health, history, and how you feel. Always discuss symptoms and goals with your doctor, not just numbers. We focus on the top number, systolic, but the bottom number, diastolic, is just as important for seniors. Diastolic pressure keeps the heart muscle supplied with blood between beats. If it drops below 60, the heart and brain may not get enough oxygen, raising risk of chest pain or heart attack. Stiff arteries in seniors can create a wide gap: high systolic, low diastolic. Lowering systolic too much can push diastolic dangerously low. Always check both numbers. If diastolic is under 60 and you feel weak or have chest pain, that's a red flag. Safe blood pressure management means balancing both numbers, not just chasing a lower top number. Low blood pressure is a hidden danger for seniors, especially when it causes falls. Orthostatic hypotension is a sudden drop in blood pressure when standing up, leading to dizziness or blackouts. For seniors, a fall can mean a broken hip, head injury, or loss of independence. Medications often slow the body's response, making this more likely. Chronic low blood flow can also affect memory and heart health. Don't ignore dizziness or unsteadiness after standing. These are warning signs. If you need to grab furniture for support, your blood pressure or medication may need adjusting. Report these symptoms to your doctor right away. You can check for orthostatic hypotension at home with a blood pressure monitor. Lie down for 5 minutes, then take your blood pressure and heart rate. Stand up and take them again immediately, then at 1 and 3 minutes. A drop of 20 systolic or 10 diastolic within 3 minutes is significant, especially if you feel dizzy. Don't change your medication on your own. Share these results with your doctor to adjust your treatment safely. This simple test can help prevent falls and guide better care. Be proactive. Your data matters. The most important lesson: treat the person, not the number. A blood pressure of 150/80 means something different for a frail 88-year-old than for a fit 68-year-old. Your doctor brings expertise, but you know your body best. Track your readings and how you feel. Dizziness, fatigue, confidence, on your feet. Ask questions about targets and side effects, especially risk of falls. Good care is a partnership. Your voice matters. Never accept a one-size-fits-all approach. The goal is to keep you safe, independent, and enjoying life. Sometimes, a slightly higher blood pressure is the right choice. Remember, Eleanor, the best care is about your well-being, not just perfect numbers.